First of all, how y'all doing today? Thank you so much for joining us. This conversation today will be around civic engagement and a call to action. When we think about civic engagement in the health department, I think in this moment that we find ourselves, that civic engagement, I believe, is a really important pathway and framing and framework for us to think about how to respond to this moment. We often think about this individual kind of response, public health, the culture is really individualistic in this society. What can you do? How can you, stop using straws to save the turtles? How can you stop eating meat to save the whole climate, the whole world? And there are these individual actions that we all must take as members of a society, as members of a community, members of a family. It's people who we are responsible for each other in a way. And at the same time, there is this bigger call and calling for us as civilians, right? As people living in a society, as members of something bigger. And to forget that, I think does a real harm for us all because we lose that grounding. And I think what we face today, this lovelessness crisis, right? Where we don't love ourselves, we don't love each other, we don't love this world that we're in. Really a return to ourselves, choosing ourselves instead of the divisive politics of, divide and conquer, the politics of them, of othering and them versus us. It's really a time for us to think about this framework of civic engagement, of how we can be members or part of something bigger. And we can do things just because it's good. We can build a world and we can help maintain these connections that have been lost, and really counter all of these negative narratives that kind of would tell us that we're a lot weaker than we are. So, for the panelists, as we're kind of getting into this conversation, I'll start with you, Jeff, and want to ask what brings you to this conversation? Who and what helped guide you to this conversation at the intersection of civic engagement, climate change, and action?
Absolutely. Wow, that's out of softball to ease my way into this. That's all right. That's all right. I came to play. No, working in an academic institution, we sort of learn, the language of theoretical frameworks and p-values and things within each discipline, and then kind of go and kind of work with communities and in some cases conducting research, in some cases trying to implement it. I came at it in kind of a circuitous route. I didn't sort of come up through academia. I came through actually local health with the city of Boston. Sorry guys, I'm a Red Sox fan. And then, but before that, I did my undergrad in theater, and there's something about like the perspective we have in the day-to-day in which we live our lives that's very different than the perspective we take when we're researching and publishing on it. So one of the things at our center and our work that we do that we're constantly sort of thinking about is what is our role as academics with community-driven work? And a lot of times the way funding is structured and research is supposed to be done, we're supposed to come to you with a pre-baked idea that we're going to test, right? And that's not fair to you. And that denies us all of the great expertise and information that all of you bring about how you live your life, about what's important to your community. And so one of the things that we've really found that some of our most fulfilling projects have been those where we've had funders that have allowed for the flexibility of this, allowed us to go in with an unfinished idea and to build it with community partners. And getting back to the theater analogy, it's like research is one light on the stage. It illuminates one side, but it casts a shadow on the other. And it's only in bringing all of our lights together that we can get the full picture and really understand what actually works and how we actually can build programs that work and why it might work in one space and not work in another and why that's okay. So not sure if any of that made sense, but it's happy to elaborate as we go more into this.
So you can absolutely. Same question.
So first I want to say thank you for the introduction, but I'm not wearing my Mount Sinai hat.
Right now.
My day job hat. I'm not wearing my hat for that. For this comment and response and just this participation because although my career has been in academic medicine largely, it has been one that has been about trying to influence without authority in the sense that as a non-physician faculty member with a background in public health, working in medicine and really struggling with the lack of a public health lens in medicine, even in a training environment, and in the practice environment, it has been just a very, very frustrating, professional journey. But most of and all of my public health background has been in community-based public health. And working with community academic partnerships. And so having the unique experience of working inside of an academic institution that has millions of dollars of research funding, situated in a neighborhood that has one of the highest burdens of illness and disease, and the community is still sick, with millions of dollars sitting in a building on 100th Street and Madison Avenue. That's unacceptable. And so I think that when we talk about action, I'll never forget Sister Pat Monahan from the Little Sisters of the Assumption. We were doing some community work. She said, I'm not in this for the sake of research and science. I'm in this for the sake of change. And, my mentors and, coaches have been the community partners and community leaders in East Harlem. And we decided that we recognized that we have the goal the whole time when it comes to working with academic partners, is that we have the data. And we know how the data looks and what to name it and to where to find it. And what I mean by that is I'm talking about, we know where the hard-to-reach populations are. We know where the underserved populations are. We know what parts of the neighborhood work and don't work in terms of, making things happen. And we know how to activate the community. And so I think that, representing the co-ed and taking on an emergency preparedness lens, one of the things that I think a guiding principle we have in East Harlem, and I'll quote my beloved Miss Carol Johnson, and everybody knows Miss Carol Johnson, it is about, staying ready so you don't have to get ready. And that just means in an emergency preparedness context, in all contexts, right? And so in East Harlem, I think we take advantage of the fact that we're a very well-connected, networked neighborhood, and we try to protect that from the researchers, right, quite frankly. And so it really is a set of relationship building strategies that has to happen in order for really getting true access so that the good work that you're describing really happens. Because the incentives are different. The incentives are different in academia versus community-based work. And, we're not on a deliverable timeline.
Yep.
We're on like every day, all day, what's happening today timeline. We're also on a just do it instead of like planning, and dealing with frameworks. It's like, no, we're just gonna do it. So, there's a lot of, those dynamics are not often named. And that is because, in my opinion, in academia, we have a very passive-aggressive way of communicating and getting things done. And that often clashes when you are, attempting to work with neighborhoods and stimulate civic action, because then you don't want to have the difficult conversations. What you really want to, is you're used to being very sort of safe and not naming what's really going on. So I appreciate, I think Mitch said at the beginning, we want some real action, real ideas. That means we have to have the difficult conversations and really name what's not being named and give voice to what's not giving voice right now. So, hope I answered your question.
And then some.
And then some.
Thank you for that. Absolutely. You said I come from the South. And Angel says this a lot, and it's something that I say too. You gotta stay ready so you don't gotta get ready. And I think it really speaks to these other forms of knowledge that pass through communities, pass through cultures. Like, we know a lot of this stuff. You gotta get ready. We gotta come from, that grandma, energy where we got some cash under the mattress. We store a little extra rice up in the cupboard just in case. We're pickling things. And that is a cultural part that we bring to this, and it's often lost when we lean so far into the science as it's presented to us through this kind of Western American framework. There are other sciences out there, many cosmologies, many different ways to see and understand the world and interpret it. And if we just look at science as we know it through this Western European lens, it's 12 encyclopedias and libraries of knowledge we don't have access to it. And we're at a point where we need to dig deep through the rubble and find the best of us. All those knowledges of the people in the communities that have been living with climate change, on the edge of climate change for so long. For the communities that have experienced catastrophe and collapse before and have lived to tell the story. These are the sorts of energies and things that community brings to this table in the space. And I think one of the big lessons for today is to really understand and reorient the way that we're thinking about community and what community is bringing to the table. People may be impassioned, voices may raise, brows may be furrowed, because we're talking about life and death, and a lot of communities are really coming from that positionality. And, for us, it's like, how do we show up despite that? And, the next question is, how, what are the lessons or what are some ways that we can go through some of those difficulties, or in your experience, and I'll start with you, Angel, like how we kind of go through the discomfort and how do we kind of build that authenticity and show people that we mean what we say, and that this, give folks a really, I guess the word is trust, or build that trust, or let folks know that we're worthy of that trust. Like, how do you think about that, and how do you navigate that?
No, I appreciate the wiggy question, and I think that's also part of it is asking wiggy questions. I think, I put the question to you all, how do you build trust with someone? It's not rocket science. It's not a whole theoretical framework. How do you build trust with someone? How do you experience trust? And I think for us, it's, in my opinion, it's like having people be seen and heard. Like, really, do you see me? Do you see the circumstances? Do you see the context? And engage in wanting to deeply understand that and ask questions, but asking questions from a place of genuine compassion and authenticity, not because you're trying to extract data. Because we also can read the bullshit, excuse my language, but, we also can read that. And I think in communities that, not all communities are the same, but I'll speak from East Harlem, a wise man told me once, he said, Angel, people always remember how you left. They don't remember how you arrived. So that is, another relationship principle that is like, well, you left 10 years ago, now you're coming back and you haven't done anything. And you want me to trust you now because now you have a whole new idea? No, we know when you left. We know how you left. And we know what you left undone. So I think that is, a really explicit relationship dynamic that doesn't always get acknowledged, And even if an endeavor comes back into a neighborhood after being away for so long and it's not the same person, it's still the same institution or the same, we're going to address diabetes again, another diabetes prevention program. Like, what happened to the first one 20 years ago that was funded by the NIH? Right. So, I think it's also recognizing that communities have long memories. So you have to acknowledge that too. It's part of building the trust.
I'll give a few quick stories. One was we did our this initiative, this Resilient Communities initiative, and one of the places we worked was in Puerto Rico after Hurricane Maria. And there were these community coalitions that we had thought had been established. And what had happened was, and this is dovetailing on people remember how you left, and folks from a government agency, rhymes with Department of Health and Human Services, with the best of intentions, came in and said, we're going to be there for you. We're in this for the long haul. They had funding for 3 meetings. They never should have made that promise. Because what happened was they ended up holding 2 meetings left. And 6 months later, we showed up, white guy in a suit from an Ivy League university, and saying like, hey, we want to re-engage with this coalition. They're like, where the hell have you been? You just picked up and left. We've been sitting here literally in the dark. What's going on? It took us 6 months to rebuild that trust and to kind of demonstrate that we were there. And so part of that is also being honest on what are the limits. Now, those folks who are saying that wanted that to be true and believed that to be true, but it wasn't true. And what happened was they had raised expectations and then abandoned people. And it made them feel good to say it, but it left a false expectation of the community and broke trust in a way that took a long time to rebuild and was never fully rebuilt with all this. So one of the first things is to really understand kind of what is our role. And one of these things we do is always as a university, as a researcher, where do we begin and where do we end? And to be very honest with ourselves about that and to not sort of over-engage as if we're going to be there 5 years from now. How can we help, but also to hold back and allow other voices to come up? And then one of the others is we always look at what are existing infrastructures and sort of with this principle of kind of restorative justice rather than sort of replace connections that are there. How can we work through the existing networks, the existing capacities? I'm usually not big on kind of the word police and the language police because that can be a distraction sometimes. But this idea of capacity building always is like fingernails on a chalkboard for me. Because you guys know what a chalkboard is? Sorry, chalkboard is like, I realize we haven't used these much. As I call you with my rotary phone. My daughter, I wanted to show her a rotary phone. I'm going to make a lot of people feel real bad here. We found one at the Historical Society in my town. I'm still getting over that. Sorry. Capacity, because it implies that capacity doesn't exist. And as we've been talking, as you all know firsthand, there's a tremendous amount of capacity that works within communities. And rather than research and academia, it's built on, I think you said it, it's a very extractive industry, right? And how can we do this in a way that creates a win-win for the communities? I have lots of other stories of kind of how it's gone wrong in rebuilding, but I think that's kind of the key thing is we have to be honest with ourselves on what our role is in supporting that work. And also know that maybe what we want as individuals emotionally is not in the best interest of that situation. And we have to be very clear and honest with ourselves on what we should and should promise.
Thanks for that. Thanks for aging me about 20 years for knowing what a rotary phone is. I think what I'm picking up a lot from this conversation, and I think a lot of it is really about some expectation setting for ourselves, as those of us out there trying to do this work, trying to make these connections, trying to meet people, trying to do the good that we want to do. There's some of the expectation setting, in the United States, where we value these capitalist frameworks. But again, relationships don't follow the fiscal calendar. These things do matter. And it's really coming out, how can we not oversell, right, ourselves, oversell our framing, but also how can we be honest with ourselves and not, for ourselves to set our expectations different. And I think as we engage with the communities, there has to be this understanding that different communities, they may have different standards. They may not align or see things the way that we do, but that just because it's different doesn't mean that it's less than. This hierarchy of learning and education and value really does us dirty when we think about showing up to communities and not realizing that they just have a different set of standards and frameworks versus looking down upon the thing that may not be familiar. Because when I think about the communities, that have produced me, as the son of an immigrant, from Central America, also a family from Georgia, and family that was in the Great Migration in this country, we, Black folks, Latin folks, we are people with a very high standard, and it's odd to me that these, the hospitals and the agencies will look at us as if we don't know what we're talking about. We have very high standards. Different, maybe, at many times, but we have to go in with that expectation. And I think some of the things that we learn from this is this concept of right relationship. You got to show up. You just got to show up. And there are these expectations of just being there and just kind of showing up and being there through the storm. And I think as we're, transitioning to the next question, we are having this conversation in September 2025, and, with the Preparedness and Recovery Institute. But this started as a pandemic response institute. And so we are 5 years after what is a world-changing, timetable shifting event, the COVID-19 pandemic. And we did a lot of this. A lot of us were not new to this. A lot of us are in positions or see the world really different as a result of what happened over these past 5 years. And so my question to the panel, as we're thinking about where we are now in the next 5 years, as we're thinking about civic engagement and this call to action, what are those lessons or the things that we have done that we can draw on? Because I do believe in asset-based approaches. I do believe in capacity building as the Assistant Commissioner of Health Equity Capacity Building in the Health Department, right? And what are the things? Because for me, asset-based, we have a lot more power and access to resources than we think we do. And how do we build the capacity that we do have? How do we stretch ourselves? How do we grow a bit in the ways that we can and not oversell ourselves because we're not, but how do we do that? So just thinking about those last 5 years, and whoever wants to respond first, like what have we gotten from that we can learn, that we can apply to the next 5, especially as we see it was a different crisis, a different plague on public health, but we're at a point where it's looking very reminiscent to about 5 years ago.
The years like the PA for
I think that some of the greatest victories, and certainly in public health with COVID and disaster resilience more generally, and in the sort of climate adaptation space, has been where that time has been invested in community relationships and working through community pathways. I started as a bioterrorism fighter, and then 2003, 2004, when all that 9/11 money came through, we're doing spent some time as an epidemiologist, and there were a lot of communities that maybe don't have a good relationship with government. And whenever we would see a tuberculosis outbreak or recent travel or something like that, and the public health nurses I worked with, the first place they would go is the community health centers. They would find a partner within the community to work through in order to reach people. And so there have been a lot of great victories in terms of kind of like listening to community needs and being able to help with those. I think where we've fallen short, sort of on a broader level, in more of kind of the expert class, is coming up with solutions to fix the formula on the board and not acknowledging how that's linked with everything else. So when we say things like, you can't go to work because you're going to spread COVID, or faith-based institutions, right? Epidemiologically speaking, not having people collected in a faith-based institution prevents the spread of disease. Spiritually, the lifeblood of the community, our identity, our humanity, this is a very sacred, important thing for a lot of communities. We probably lost more ground than we gained. I would argue that there are a lot of cases like that where maybe in righteously solving the problem in front of us, we maybe created a lot of the conditions that we're suffering through now in terms of the polarization and the loss of trust with communities. It takes longer. It takes more money. It takes longer in the short run to have genuine community relationships, but in the long run, it always pays off. Just very quickly, I'll geek out on the data for a minute. The evidence is there. The strongest predictor of how communities do during and after a disaster from health and mental health perspective is social cohesion and social capital. Investments in community pay off more than investments in infrastructure, more than investments in planning, more than investments in any other area. So it's not a cost for taking that time up front. It's an investment that always has a higher return.
To respond to your comment about the investment, it's all about who's got the money.
Yeah.
All right. I mean, it's all about, what's in it for me if I invest. So I will say the COVAD started 10 years ago. And full disclosure, it was a result of my dissertation work. Through my dissertation research, we landed on the strategy that hyperlocal planning is the approach that will save Black and Brown communities that are geospatially vulnerable. And we knew historically that there's plenty of data evidence that shows that low resource Black and Brown communities that are geographically located in geospatially vulnerable areas, and we can name them across the country, right? Lower Ninth Ward, Lower East Side, Staten Island, the Far Rockaways, are the first to get hit and the last to reconstruct. That's the bottom line. And we said, you know what? We're on our own. I'll never forget I had a DOH colleague said, you know what, Angel, the truth is that communities like East Harlem are so far away from Central Command Center that you're on your own for at least the first 8 to 12 hours. And that's where we're like, well, we need like an 18. We need like someone to like activate in the neighborhood. And that's where we looked at the COVAD model, right? That it exists in the central part of the United States, in the Tornado Valley. We're like, well, what if we did at the neighborhood level? And we, shout out to LES Ready and Staten Island COAD, because we look to them to take it, zoom in even more, like literally 2.4 square miles. How can we create an approach and a rooted strategy that allows us to activate and respond? And so we've emphasized ready because we want to make sure, are we equipped to act now? The preparedness is all the thinking and designing and learning. Are we learning everything we need to know about hazards and things like that? We're not talking about resilience in East Harlem, because we're already designed to be that way because of systemic racism and oppression and how the neighborhood is got to be the way it is. So our focus is on readiness. Can we act now? I think that COVID revealed the system onto itself, meaning the public health and medical care system is in shambles. We never had it together. And COVID revealed it blatantly, explicitly. And as we thought, neighborhoods like East Harlem were ignored, overlooked, and were not paid attention to. Well, we needed masks, literally, masks and sanitizer. I'll never forget, it was April 16, 2020. East Harlem's zip code had the highest infection rate in any other zip code in Manhattan that day. And our city council person was begging for masks, literally. So we said, the probable almost certain future, if we don't do anything, is what is happening now. And that's what bolstered the COAD to really get activated. Now, when COVID hit, we had to, it was the first time we were gonna do a tabletop community-wide exercise, oddly enough, ironically with the coronavirus and the blackout. COVID hit, everything shut down. We pivoted to it now becoming a virtual resource for our neighborhood. And primary role was curating information and making sure that it made sense to East Harlem. And of course, building out networks. And then we started tracking the rashes. What I mean by rashes, things that the pain points. We literally made a list. Like, masks were not delivered. Here, we've got this. We had some critiques with our colleagues in the DOH for the data, tracking like where are the sites to access this? Why does that data look like that? Where's the East Harlem data? We were tracking because we were ready to have a conversation with our colleagues in the Department of Health, with elected officials, whoever was ready to listen. I think that for the next 5 years, Julian, I believe that the probable almost certain future in the next 5 years is what is happening now if we do not take a systems change approach. And I think that the juicy richness of communities is that system change is identifying the conditions that holds the problem in place. And so from an academic perspective, we could get really theoretical about that. But if you are deeply rooted and connected in communities and ask that question, why does this keep happening? Why is the neighborhood still in disrepair? Why is the sidewalk on 116th Street still broken? What's making that, what holds that in place? And you will get the most amazing, profound insight of what's really making, keeps that crack on 116th Street. And that's where the change starts, because once you can identify the conditions, you can then build out a process of what are we going to dismantle, redesign, reimagine, address. So we use emergency preparedness to really get at other daily hazards. They're like, Angela, that's out of sight, out of mind. I'm like, oh, we got to change this to one day, Sunday, to an all day, everyday way of thinking. Hence, stay ready so you don't have to get ready. Let's figure out the small wins. Let's address the crack on 116th Street. I'm not going to teach you about a go bag right now because the crack on 116th Street doesn't allow the walker to go through. So let's find the small wins and scaffold that to bigger public health challenges like climate change. Because climate change is not a real thing to hold on to in East Harlem. What do you mean by that? You gotta find another way to connect it and find the back door so that folks can appreciate that there is a movement that has to happen. And so I think that we're not creative enough right now. And I think that all the change that's happening politically is coming so fast, so strong that we're all caught off guard and we can't organize. And I think that's where, you have to start with the hyper-local planning approach and hyper-local organizing and slowly build out, design and build out. And that's gonna take time, but it also means investing, right? People, money, and space. They did it.
All right now. Thank you for that.
And breakfast.
Thank you for that.
Thanks, Mitch.
I think as we get ready to transition into the Q&A, I think another, you said it again, and I think I'll add another truism. You don't gotta stay ready so you don't gotta get ready, but another one, if you wanna be somebody and you wanna go somewhere, you better wake up and pay attention. We are being told that none of this matters. We're being told that it's a farce. We're being told not to trust our eyes when we see the sky turn orange and smell like a hickory barbecue. We're being told to ignore the fact that these floodwaters are rising at rates that we have not seen before, that we have a super storm after every once in a lifetime storm, every storm season, multiple of them. It's a real time for us to really wake up and realize what's happening around us. There is some collapse going on, but we've lived through it before, and we have the tools, and we know how to kind of respond, to the next version of this. And I think as we transition to the Q&A and folks are getting their questions ready, I think that we're at a point where we have to move in a different direction. We have to let go of some of the things that we used to believe and be beholden to and all of that. We have to let some of that go, and we have to really get yourself a political education. Go out there and understand the different ways that people have resisted over time, over space, the ways that people responded to political repression. There are playbooks out there that are readily available for us. There are new words and languages and framings that can help us go deeper and understand what we have to do in this moment. And we don't have to, our ultimate goal individually should not all be Martin Luther King, Malcolm X, but you gotta start somewhere. And so I think for those who are thinking about where our climate action begins or whatever, it starts with the first step. It doesn't have to be the perfect step. It's not gonna be the one thing that does everything. But to face that right direction and to start moving in that direction and think about how I can be a part of this movement, how I can be a part of getting, of climate action, of emergency preparedness, of getting to know my community and being a part of a community and civically engaging. Congratulations, y'all. This activity right here, this is what civic engagement looks like. Going to join learning about these things, that's civic engagement. Showing up to the protest, right? Talking about the things those unspeakable things, speaking through that is civic engagement, raising awareness. That's all a part of a broad landscape of activity and actions that we can all take to be a part of the change that we want to see. Because I do believe that it only exists, the change, the love, the equity, the diversity, all of that only exists as much as we put it out there, we pour it into the world. And I think that's one of the most beautiful things in this moment, that we have access to each other, and we do have the freedom to speak about what we know and what we see and what we feel. We can still do that. And don't let anybody tell you different. Q&A?
Got that.
So thanks to the panel. If folks have any questions, comments, responses, go ahead and raise your hand.
One year.
So thank you very much, Dr. Dawson, Harlem here, public health consultant at New York State Harvale, and my own consultancy. So I was just thinking, climate is a very broad subject, right? And so I think you got to prioritize. And how do you do that? I came up with something I call the Public Health Preparedness Priority Pyramid.
Yeah, do it.
So how do you get to the top of the pyramid and the bottom of the pyramid? So how do you fill that pyramid in? My instinct is how to determine the pyramid scale. I say do a survey, electronic. We got members here, we got people who didn't show up. And I work with a series of senior centers and churches and public health and organizations. I got my network. And so I just asked these folks 10 questions. What's important to you? Won't you rank them for me? I go to church. Won't you rank them for me? What's important? You gather that data, the brain trusts get together and figure out what's important, then and a pyramid to fix it. But you ain't gonna do everything at once. I mean, maybe we can. Maybe some more people around. So you got to prioritize stuff.
That's right.
You know, and so that's my motto. What do you prioritize? How do you prioritize it? Who determines what's going to be prioritized? Right? And so I think, you know, because otherwise, this way and that way,
Yeah.
you know what I mean? You got to get prioritized. Thank you.
Thanks for the comment. I mean, at the end of the day, you gotta pick a path and just start walking it. You know, like whatever resonates for you, whatever skill set comes naturally for you, whatever predilection you may have towards. Maybe you're a talker. Maybe you're a convener. Maybe you like the host. Maybe you're an organizer. Maybe you can really convince people and bend the hearts and minds. Whatever it is, we gotta find our path and just commit to it. And you will take different paths and find forks in the road along the way. But it's really deciding how can I dedicate my time and add this to my to-do list for the day. Any other questions? Oh,
And I am so excited.
Hi, good morning. My name is Mariam Khalid. I'm a manager student right now at the Maryland School of Public Health at Columbia here.
welcome.
Very funnily enough, as you guys were speaking, my roommate texted me that her bathroom got flooded. So this is a very timely thing that, as in like right now, it was happening. She's okay, stuff, you know. But I wanted to ask, especially in like this day and age, especially in the past, I'd say like 5 months or so, when people are now being skeptic of government organizations providing data. I'm a biophysics student, so data is very important to me, especially when there's a fear that, data might be skewed by certain people in office and like their pressures to want to create a narrative, etc. How do we like navigate that, especially like literally this week with what's going on in terms of the discussions around like Tylenol, for example. It's not related to climate per se, but it's just the general phase of like public health and people trusting what they hear than ours.
Thank you.
I can talk a little bit on the data question because we run into this a lot too. A lot of the indices and things that we create rely on publicly available data, quality public data. And unfortunately, so the challenge, I'll say the challenge and then some things that can be done. The challenge is that like if the federal government stops collecting this data, a lot of the derivative products, the social vulnerability index and things like that fall away, right? Because we don't have the data to feed into that. And most people will, you can get funding to collect data once, but not to do it every year, right? So public data is one of the most essential pieces of infrastructure that we have to invest in and continually invest in. And all over the world where we're talking about AI and things like that, how it's going to democratize, knowledge and things like that. And that's all well and good if you have publicly available data for your country or for your community. That being said, I think some of the ways New York City actually has some of the best data collection and data transparency anywhere in the country and potentially the world with all of that. Really pioneered a lot of great work during COVID as well too. Within academia, we find a lot of times it's a one-off, but there's constantly sort of a pipeline of studies and data sets and things like that coming out. So there are going to be ways to kind of collect data, but we still need to sort of advocate for that value of having that publicly available data to draw from, because that's one of the most important foundations that we have. So there's multiple sources, but do longitudinal tracking and changes over time and look at things nationally. We also can't, pull back as we are, and so that's one of our biggest concerns.
I would just say from a community perspective, I think, I think there's an opportunity, especially when neighborhoods are really networked, that there's coalitions of providers and community-based organizations that, and this is, a one day, someday dream of mine, is to really do local data collection, right? And teach and build the capacity of agencies and organizations to understand their data and working together and like, well, what if we want to characterize this particular population in our neighborhood? What do we want to know? And who knows that, right? And literally having, building a brain trust in a data unit, if you will, that is community-based. And I'm sure there's some efforts across the country and examples of that, but I think that we shouldn't overlook that and explore that as an opportunity as well, especially at the moment.
Absolutely.
Next question.
Yeah, Joel Kupferman, the National Lawyers Guild and Environmental Justice Initiative. We take a little exception about the data that's out there. We're the ones that grab samples in front of the World Trade Center, had a sample, we foiled the city, state, feds to try to get that information. And there's a lot of misinformation, but also it's thousands of pages of data that came out. I think it's important that we get accurate information from government agencies. We're working now on representing people at St. Nick's Public Housing, Legionella breakout, and we had trouble getting money from this, but correct data from the City Health Department. We just found out 2 days ago there was over 20 deaths. The City Health Department just said it's 10, all right? So we think part of the problem is that in academic, there's a lot of people that get paid, spending time gathering data that's somewhat too late. We're talking about disaster response. We need up-to-date data. We also need the information that public is getting. We're doing pictures, we're doing samplings, we're doing air sampling, and then we bring it to the government that can act and go after the bad guys. And they said it's not done scientifically or not enough. So I think I'm, asking you to address, the city can't blame the feds for the lack of funding. There's millions of dollars being spent. How can we make sure that there's more information provided to people on a timely basis for them to react to make sure that there's increased transparency on city and state information?
Thanks. I mean, that's a great question and builds on the last question that we were responding to. And I'll say these counterbalances from people outside of the systems are vital to the integrity of the system. Local experts, people who are holding these agencies accountable, who are requesting the data, who are foiling, that is a necessary counterbalance to the inertia that comes with being a big bureaucratic system that can't move so fast. They have these standards that have to be met with the data. We have to wash it. We have to verify this and everything that. And there is a delay that sometimes that can be inhibitory, especially when you need to respond fast. A prime example that I'll share and see if you guys have another response, the mpox outbreak of 2022. We were a global epicenter. And the health department, we stood up our response very kind of typical in the way that we normally have. And we got dragged for it in the New York Times. They're like, oh my God, why are all the only resources going to Chelsea? We know the demographics there. And there was this reckoning where we had to really lean in and do something different. And we received that. And I think one of my greatest honors was being a part of the mpox response, where we were working with community leaders, with academics, community groups to find out the places where we can go, what is happening, and devise ways to respond in a more real time and get the vaccines where it needed to go. We went to the sex parties. We went out and got different messaging to be able to build and grow on, and to do that, but it's a necessary counterbalance. And holding the cities, these jurisdictions, even more now than ever before, I would say is it important that people hold us accountable. And really, there's ways to change and shift the way that we're managing the data, and ways to sign new agreements, especially in an emergency. And those are the things that we're thinking about. Those are the things that, as we're doing our emergency preparedness, and I see Julian from the New York City, from the Mayor's Office of Environmental and Climate Justice, the city, we're thinking about these things. We're really thinking about how we can do it, and the external pressure is essential for holding us accountable. I hear you, and this is one of the things that we are fighting for in the Center for Health Equity.
The city is not even informing their employees of what they're exposed to. There's something called PESH, it's city's OSHA, state's OSHA, that those workers who go to and make the complaints, a lot of those workers don't even know. So the scary thing about the Legionella is 8 of the 11 facilities were city-owned facilities, all right? And they didn't tell the people working in those buildings. When we had the Legionella breakout, we asked for urine testing, which is really, really expensive. They refused to do it. So we think part of the problem is the city's got to look at with all this stuff that's saying what the city is doing. People are being told stop, asking or whatever we're working on. What I'm saying is that it's almost like it over research, not to provide the information, but the city is a guilty party of not letting people know. And also we have to open up. A lot of people don't even know there's environmental occupational clinics that people, when they get hit with an environmental impact, they go to. There's a wall up there. It's very hard to get in.
Yeah.
But the city, when the people go to the websites, they think the state and the city is doing all this great stuff. Go home, and we'll acquit.
Thank you. And feedback received and transparency, direct engagement is a part of it. And again, these are big systems. New York City Department of Health and Mental Hygiene celebrated its 220th anniversary, our birthday, last week. We are fighting over a lot of inertia and systems and silos and walls and everything that have been up for years. We're chipping away from it. There are people in the city government who understand and see this, who are working and organizing. And again, this accountability, calling us out, saying it, to continue to keep fighting, keep knocking on the door. That's how we can be accountable and build the systems to actually be better and be responsible. To the next question. Yes.
Hi, good morning. Good morning.
Good morning.
I'm looking to give more perspective on the relationship between mental health and climate action and civic engagement in general. I appreciate that a lot of the talking points from the board this morning had to do with trust and expectations. So I'm curious what each of your outlooks and experiences are with public nihilism, feelings of enemy, or general hopelessness from those who resist or oppose progressive action.
In your name and where you're.
My name is Mark. I'm coming from Boston, and I'm working on a startup called Clarity.
I'll talk a little bit on this, and yeah, we'll see where this goes. I'm not sure if I'm going to get in trouble or not, but yeah. So first to start in terms of what I mentioned on social cohesion, social capital, how connected we are as communities, neighbors helping neighbors, and rightfully brought up as well too. The current state of being is based on decades and even centuries of colonialism, of practices that have been designed to sort of fortify or disrupt social cohesion within neighborhoods, which are measurable along many, many different lines, which is it, that we see in disparities, health disparities, et cetera, et cetera. One of the biggest things that it does is that by neighbors helping neighbors, keeping people together, having strong community cohesion, we're checking in on each other, and those connections are insulators of mental health. They help preserve mental health. They help with that mental health recovery, and so that becomes one of the most important aspects of that, and is very measurable and a very strong correlation. One thing that I would say too is that, and I take this, as someone on sort of the climate action research, a very advocacy component within academia, is that sometimes we're the problem. Sometimes we get so anxious over the data that we're seeing that we forget that we have to bring everyone on board with us, and we kind of ignore the day-to-day struggles that communities are having. That climate action is a really important thing, but if you're in a mill town and seeing your jobs disappear, your pension disappear with no mobility and nowhere to go, that's far more real in the immediacy. And so kind of back to some of my other points. So I say too that I think, that we need to look at those investments that kind of fortify community resilience, our connections with each other, community solidarity, all of the community institutions, while also recognizing that, and we'll have some breakout sessions that actually talk about this more. My colleague Josh DiVincenzo is leading one. He did his dissertation on this work, where there are different avenues for talking about climate change that resonate more with the experience that people have day to day, rather than taking a top-down sort of data-driven, the world is boiling and you're all going to die approach, which I think can be a contributor to some of the mental health impacts of this. I don't mean to say it's all our fault, and there's plenty of other stuff going on in the world, and that's why I'm not watching the UN speeches, but just to acknowledge that this is a shared responsibility that we also have on our end. When I say we, I mean within the academia, the climate advocacy community.
I'll just say that addressing mental health is a longstanding unmet need in East Harlem, regardless of climate change or not. One, two, when COVID hit, the first thing we did as a co-ag was develop mental health resources for the frontline staff. Because of our relationship, because it's community-based organizations that are that make up the coalition, we said, what do you need now? They're like, our staff are mentally burned out. And so what we decided to do is take on a trauma-informed approach and provide ways, short clips, videos, tips, strategies, how to run a staff meeting in this moment that's trauma-informed. And I think that is a very important lens that is missing or underutilized in emergency management, emergency preparedness, and I think is absolutely critical when we're doing hyperlocal planning, because it's not just the climate change, it's all the other things that's happening. Like I'm stressed out because I can't afford my rent, because the neighborhood is gentrifying, because, right? So when you ask someone what is keeping you stressed out, it's not climate change. It's because they can't make the connection in this immediate moment. And that's where I think being trauma informed and having the skill set to do that is absolutely critical, so that we can just holistically support communities. So here.
One last question.
Good morning. Thank you for everybody's input, especially when it talks about the data and the hyper focusing on communities. I think that's really important. I work for an organization called Live for Redemption, and we serve East Harlem, Central Harlem, West Harlem, and we deal with a lot of young people. And this conversation about civic engagement in any context is like so foreign, particularly when it comes to like what's important to them today. All the challenges as poverty related, health, mental health challenges. Are there any plans or any strategies that's adapted from the data that we have to engage with our young people, particularly because these are the ones who are going to be taking care of us in the next 10, 15 years? We have a lot of adults in the room, and these conversations are rarely had with children in the room or young people in the room. How do we have those conversations?
And your name?
My name is Kyrie.
All right, thanks, Kyrie. Great question. I can start in the response, and I'll pass it to the panelist. I think this society, we don't do our kids right. I think that we don't really look at kids. We try to protect them from this real world that we live in. And apparently when they're like 18, it's like, okay, go out. And the reality is it's not like that. And this evidence shows that younger and younger people who are connected, people have opinions about climate change. The kids have opinions. I was talking to my 12-year-old niece when I was in Texas a few months ago, and she's asking the hard-hitting questions about climate change. What are we gonna do? Why do people care about the economy when everything's burning? And like, she's 12. So the kids know, and the kids are thinking about this, and we're not doing them any favors, and we're really kind of discrediting ourselves by not talking to them about what is actually happening, what is happening in society, the changes that are there. And I think it kind of starts with we can give the kids more credit than we do now. I think it does start with education and understanding that we have to talk about the uncomfortable things. You know, we have to talk about the blue skies and the gray skies. Those are the things that we have to get comfortable with. And before I pass it, I think it's also in response to this last question about the trauma-informed, engaging and mental health. I think there's also the fact we have to name and acknowledge that we have experienced a mass traumatizing event.
Actually, that's
The pandemic of 2020 was a mass traumatizing event. We saw things that people should not see. We also see a lot of things on these phones in our pockets that are traumatizing, things that you're not supposed to see. Bombs dropping, people being starved, the inhumanity and that lack of love. We have to name and talk about those things as not normal, to denormalize that, and to begin really engaging with our kids in different ways. And it's a reorientation. Like, these children are our community, and we can't just bring them in when they, come of age.
Yeah, I really appreciate the question as well too, and it's something I work within the climate school within our center that we've come to wrestle with. Let me just sort of first acknowledge that and this even come up in our internal discussions. It's always hard talking about this because we recognize that Columbia University has, let's say politely, a mixed record in terms of its relationship with the communities that it's in, right? And so I'll let you call it that in however you want. But at the end of the day, we have a presence here and have a commitment that we are looking at how we can better honor that relationship with those humanity. And I'm speaking on behalf of my portfolio at the moment. Recently, I've taken over some programs, including our pre-college programs, and we're actually actively looking at that. And I would love to get contacts, names, addresses, not address, that was weird to say, but contact info as we build out programs that are specifically focused on youth engagement. We've had a number of workshops. These have been around things like, what is climate change? What are the actions we can take? What are the steps we can take to prepare? How do we connect with our own community that are more empowering rather than here's all the ways it's going to kill you, right? But also we're looking at expanding that, creating more practical experiences sort of in the field and kind of helping to be a part of projects and co-development that it's in the early stages, but we're hoping to launch that in the coming year. So definitely seek me out. My email address is on our faculty page for the climate school as well too. I'd love to engage more on that. And I think you bring up an important point that there's some work that we're doing, but there's much, 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 much more that we need to do. You were your phone.
Yeah, I just want to add that I think, especially young people, they're not, I'm also an aunt, I'm a tia, I'm a titi, and it's so profound to me how much a young person isn't seen or heard in general. And, I think for any human being who wants to be seen and heard, so much can happen, like being fully self-expressed. And I think, the data is the data, but I also say, what's the data? What is the data not showing, right? What's missing from the data? And I think there's these sort of other strategies like pathway programs or career-connected programs is a new phrase I'm hearing that really opens up this, young people in ways for them to seek possibility. And I think if we could be really good at that, I think we'd have some real change makers, in the future. And so.
And
For those who had questions that we couldn't get to, jot them down. We'll definitely have time to talk about these things and really engage throughout the rest of the day. We're going to transition to a little break, and then we will get ready for the breakout room.
So